Welcome to HERcast with Dr. Chito. Today's episode is Back Pain No More, How to Protect Your Spinal Health. Back pain is one of the most common struggles women face, from long hours at work to the demands of motherhood and even the changes of aging. But the truth is, much of it is preventable. Joining me is the amazing Dr. Biodun Ogungbo, a UK trained consultant neurosurgeon and CEO of Brain and Spine Limited here in Abuja. He's one of the Nigeria's leading voices on spine health, trained and worked in top UK hospitals, and an advocate for stroke and spinal cord injury care. Together, we'll uncover how to prevent back pain, protect your spine, and live stronger, healthier, and pain-free. Trust me, this is an episode you do not want to miss. Welcome, Dr. Ogungbo.
Thank you very much.
I love that laugh. Welcome to HERcast with Dr. Chito. I'm so excited to have you here.
It's great to be here.
You know, I've been bragging about you all week. And having you here, just saying that this is the top neurosurgeon. And when it comes to speaking about this, you're the right person. And I'm honored to have you on HERcast.
Thank you so much.
I am
grateful.
Now, I'm just going to jump into it as a discussion. And being that, with us, we can talk easy.
Yeah.
What are the most common causes of back pain you see in women today?
So let's start by saying that I see more men than women coming in with back trouble. And
Sorry,
also,
is there a reason why men have more back trouble?
No, that's just my practice.
Oh, your practice.
That's just my practice. But when women come with back trouble, it's often slightly older women, over 50s, and more often than not, they do have a problem. They have a pathology. They have either a disc bulging in their back, or they have something that we call spinal stenosis, which means there's pressure on their nerves. So I see those who actually have a problem, not just ordinary back pain that doesn't require any intervention. The ones I see have had chronic back pain. So they've been suffering from back pain for a long time. That now it becomes particularly important for them to get a solution.
To improve quality of life.
And so they come to a neurosurgeon, and then we're looking to what are the solutions for this. But what we should be talking about is how to prevent this. I want them to stop coming when things are pretty bad.
But that's what I think is one of the reasons, because you said you see, not as many women, but I will tell you from the women's health point of view, when patients come to see me, on their list, they always have back pain. Those that work in offices, part of their complaints, I've been having this back pain. So I see a lot of women that say they're having one back pain or the other. Some will say, okay, after my epidural, I have back pain. Even younger ages having back pain right now, honestly. That's why I'm surprised. Now I understand.
It means that they bear it. Exactly. They have been living with pain, for such a long time. So many of them have histories going back 5 years, 10 years, of suffering from back trouble before actually presenting to, a practice like mine.
Why men can't bear pain?
Women, absolutely. They come quicker than the women do. So women put up with a lot of, pain and suffering. And maybe many assume it's part of motherhood or part of life. Or, I don't want to say they don't have the support from, their significant partners.
Or they don't have time. They feel they don't have time for
or they don't have
themselves.
the time to actually look after themselves.
Yes.
So that's the issue.
Okay, so why is this, what we're talking about, why is spinal health so critical for our well-being beyond just pain relief?
I think it is important for everyone to actually think about it. And when you start having any niggling discomfort in the back, that's the time to start, looking for a solution. And the solution might just be something that you can do at home. It might be simple stretching exercises, it might be going for walks, it might be, just changing your posture. It might be for women, think about not wearing high heels.
All the time.
Do you know what I mean?
All the time.
Yeah, so those are the, little things that you can start doing for yourself and nip this in the bud before it becomes a significant problem.
When you're saying about, for example, posture, what are you meant to be doing? I don't understand, because people just tend to have, when you're young, your mom will say, sit up. But then that sit up,
Yeah.
is that really the posture? Because when you say posture,
Well, that is
suppose
the posture in a way, but on the other side, it's not slouching.
okay, not like
Not
okay.
just sitting in a slanted position, not caring what your spine balance is, or how your back is actually positioned either in the chair or on a bed. There are people who read in bed. I advise against doing that, because for one, your neck might not be in the right position, so your neck is crooked, and then your back is also not supported. Also, the kind of bed that we sleep on, beds that lead to a dip, where the bottom is, can also interfere with the spine and lead to back trouble.
Okay.
So those are the things that people can do at home when they start having discomfort. Just start thinking about all of that, and if you can correct those little things at home, it might prevent back trouble in the future.
Many people talk about, one time someone was like, to know your posture, stand by the wall, just by the wall, and then you can, I can't remember what it was, but the person like, stand by the wall, and then you feel the space, I guess, between your lower back and the wall, and then can you explain how that correlates with having spine issues?
I think it's difficult to say whether that relates to
It's just
spine issues or not. I don't think about that. And many women have, for want of a better word, significant glutes. So if you're standing by the wall,
to be politically correct.
if you're standing by the wall, it might be your glutes or your bottom that's actually touching the wall. And if you're going to then lean back, you're already altering the posture of your spine, and that's not natural. But the thing is, whatever position you're in, there should be no discomfort. That's the key thing. So if you're sitting for a long period and you start having discomfort, the advice is get up, go for a walk, do something different. If you're lying down and it's causing pain, that position that you're in is not good for you. So there should be no pain. That's the key thing. There should be no discomfort. When you start having discomfort, that's when you start thinking. And the little things are change your position, get up, go for a walk, just do different things, and then see how that helps.
But in an office where women are required to be like sitting down for it, and so they can get involved with work where you're required to sit for a long time, apart from just getting up, is there anything else that those that sit down for a long time can do to support their back?
Yes, have a small pillow in the crook of the back. That is important. Secondly, for those who use computers, have the monitor put at a level that is at the eye level, so that you're not straining, you're not bending, or looking down at the computer. Those unnatural positions can strain the muscles. But subsequent to that is that they start damaging the joints in the back, and then that leads to the kind of problems that I see. But they are preventable in a way, because at work, watch the way you're sitting, make sure the chair is comfortable, make sure that your monitor is at the eye level, and get up as often as you can. After 30 minutes, after an hour of prolonged sitting, get up, take a walk, then come back again. That will help.
Okay. Now, at what point, I don't hope I'm not saying the word again, but at what point should someone stop dismissing back pain as normal and see a specialist? And I say that because women have a way of enduring pain. And I'm saying that as from a women's health perspective, where they always come with, it's not that it started, we always like, oh my God, how long has this happened? And they're like, oh, for like few years now, or how many years now? I just haven't had time, or I didn't even know if it's a problem. I just take medicine and I just keep going. So at what point should women say, oh my God, I've bared this long enough. I need to actually see someone and to make sure it's nothing more than just muscle cramps?
I think 6 weeks is enough. To be honest with you, if you've been suffering from back pain for 6 weeks, it's enough time to get someone to look at it. We don't have to do anything. It may just be that reminder about the things to do and caution about things that you're doing that are wrong. It may be all that's necessary. But 6 weeks of suffering is more than enough time before you go and see someone. You can see your general practitioner, see your gynecologist, see a physiotherapist, or see a specialist. But at least after 6 weeks, see somebody and get advice.
Nice. Now, we talked about those sitting down. I'm going to come back to our professional surgeons. How about people that stand? Because when you say we're talking about slouch, I was thinking that as a surgeon, we stand and we slouch. Like the table, I'm sure you go to hospitals that are not your own, like to do help or as a consult. And you have set up your own to fit yourself. But when you're with someone and you're bending or you have to, and like some hospitals where the bed doesn't move, how can you protect your back? Because some of my surgeries, well, they believe I'm not a real surgeon. It's short. But your surgeries are like hours.
They take hours.
So how would you say you protect your back in that situation when you're standing and working?
I think for us, the neurosurgeons, spine surgeons, or general surgeons, oftentimes you should adjust the bed and the height at where you're operating to be comfortable for you so that you're standing straight and still being able to see what you need to see and do. Sometimes you may have to stand on a platform to gain that, height. More often than not, we use gadgets. So sometimes, we use microscope. So with the microscope, you can stand perfectly straight and still be able to see and do what you need to do. Oftentimes as well, you can sit down, or you can, an hour, 2 hours of operating, you can take a break. Go have a sit down, just relax, and then you come back again and do what you need to do. So there are tricks that we use, in coping with operating for long hours that actually then helps in, preventing back trouble. More often than not, of course, we suffer from neck pain because, sometimes you can't help but bend your neck in an unnatural position, to do the operation, which is why, these days, using a microscope, using an endoscope, those are the gadgets that are now in play that helps us in preventing neck trouble, especially.
Okay, now we're going to talk about something that really is plaguing our society. Even our society would say economy, but we still have a lot of big issues about overweight and obesity and how that relates to spinal health and back health. Because I know you said we're going to focus on lifestyle, wellness, and how that will relate to healthy spine or a healthy, back muscle, whatever. What will you tell us about that, of being an obesity?
I think if we go back to women, starting with menstruation, some women have significant back pain during menstruation, and that every month can make life truly miserable. But so long as we understand that that is related to menstruation and the pain is actually not coming from the back itself, but from the pelvic organs and the uterus, that is okay.
Yes.
Pregnancy and childbearing, many women put on a lot of weight during that process, and that's the genesis, of back trouble for a lot of women is that they start, when getting pregnant, the body develops a lot of weight and water retention, and they find it difficult to get rid of that. That then leads to acceleration of their back problems. Of course, if you leave that alone and you get to menopause leads to problems with the density of the bones. That leads to muscle weakness, bone breakage and all of that. So women have particular issues, related to them, that, in the first instance, the obesity or the weight gain leads to back trouble. Menopause leads to, reduced bone density, and that, causes pain. So how do we prevent that? Women should realize that, yes, you can put on weight, during pregnancies and after delivery, but you have to start trying to get back to what is your ideal weight. And, that is critical. So that's what women need to do.
Because I've seen where someone comes to you and you say what you need to do to get this pain away. I mean, it was a guy, but what you need to do to get this pain is to lose weight. So can that be something that significantly can improve how you feel for your back?
Definitely. For those who have the mental strength, because losing weight is not easy.
It's not easy.
Oh, losing weight is, and I tell my patients that it's not something that's going to happen tomorrow. It will take months and years. but it's the work that you put in. It's that consistency, that's actually daily thinking about your diet, doing exercises, and actually, being focused on, I want to lose weight, and then, following through with seeing the improvements that you're making. That's the key, that you have to be consistent. You have to be serious about it. There are many of us who will not perform an operation on a patient until they've lost weight.
Yes.
Sometimes we are forced to operate on people who are obese, but that's because they are in more danger, of damage to their nerves or damage to the spinal cord, that we don't have a choice but to operate and then, take the risks, whatever happens. But if there's minimal risk of damage or permanent injury to nerves or spinal cord, we'll say go and lose weight. Because if you actually lose weight, you take the pressure off your spine,
yes,
the pain will probably get a lot better. And even if it doesn't, if we have to operate, we're now operating on somebody who has less weight on board,
yes,
less risks, less complications. It makes our job easier, and of course makes the outcome much better for the patient.
Because many people don't know that being obese can really affect your risk when it comes to healthcare.
Oh, it does.
I've seen
general,
emergencies, everything. So just being your ideal weight and being healthy is an advantage for so many reasons. And now you hear it's an advantage for backache.
Yes, it is.
Now, what kind of exercise? I mean, I was telling someone that day, I think squats, and I'm like, I think I'm off, or maybe I'm not off. But what kind of exercise helps us to strengthen our backs? Like you talk about losing weight, but how about also the muscle? Like, see, since I've been doing this, I've been trying to sit up. I'm not slouching. I've really been like, my back is like straight because I'm a sloucher. But what exercise can we do? And because, many people can be so busy. And when we talk about going to the gym, by the time you're tired and you think going, you're like,
I'm not doing that.
But are there things we can just adapt that we can do right beside our bed or in our houses, no matter how busy we are, to just improve our back health as much as possible?
I think the first thing is posture and recognizing when you have a bad posture. And then, in bed, ensure that your bed is firm enough, that there's no dip in the middle that alters the shape of your spine. And then using a pillow that makes your neck in a natural, easy position, not
straight?
Straight, so that your neck is not
elevated.
your neck is not bent crooked forward like that. So that's the first thing to do. The second thing is just even stretching exercises. When you get up in the morning, do some stretching exercises. That's so very important. That helps the muscles relax. Because sometimes it's the tightness of the muscles that causes pain. So regular stretching exercise. And you can have your own system of what you do consistently. So when you wake up, even in bed, you can, stretch your legs, move your legs up and down. Just do some exercises, stretches in bed like that. Then you can do yoga. For those who appreciate or understand the benefits of yoga, is actually quite important. Not only for helping with the back, but more even for mental relaxation and to remove stress. That's so very important. So those are things that you can do at home. If you can get a trainer or you can go to a gym, then you're elevating, your achievements in a way. You're making progress. Exactly. You're now making progress. And if you can do that, that's great. But get somebody who actually understands what you want to achieve. So it's not about, putting on weight. It's more about, just, feeling good with yourself, relaxing the muscles, and then the exercises, help, to prevent injury. In this case, we're talking about back trouble. So that, can help prevent problems in the future. So I think at home we can do a lot, both mentally and physically.
When you were just talking, something came to my mind. Some of the things that I had to learn, even in healthcare, especially in healthcare, when you're dealing with lifting, and how some people's problem starts from just one lift.
Yes.
Do you understand?
Yes.
And I noticed that here, people just,
Yeah.
you go and see people in the outside of this, everybody's like bent over lifting. And I think that's another thing let's talk about, like that lifting. Because some people's problem starts that lifting and never goes away. It's like, it just starts and then as if something just, goes, and then you're dealing with back pain for the rest
absolutely
of your life.
I have seen patients who, have lifted a gas cylinder or a suitcase, or they've lifted a generator, or they've gone to the gym and lifted, some weights that they're not, accustomed to. So that can, in a way, lead to muscle injury, damage to the joints, or in fact, discs. They said the shock absorber in the spine bulging out and pressing on their nerves.
Wow.
So that, is important to talk about.
Yes.
That, lifting weights that one is not accustomed to and lifting it in the wrong way can actually precipitate or start, downward slide to back trouble. So, if the weights, and people should know and maybe ask for help. Ask 2 people or 3 people to help to lift rather than, doing it by yourself.
That's why you see more men.
True. but women also, women carry heavy bags.
Yeah, we do.
Well. Women carry heavy bags.
I'm one of them.
That's something to
but how about kids? Let's talk. I mean, now my biggest worry sometimes is the size of the knapsack for young people. I feel like maybe they're going to have future life of back trouble. What's your thoughts about these knapsacks? I don't know. So when I see my son, I'm like, hey, God. And he wants to put on his laptop, everything, and then put on his back. Yes. And I'm thinking, I'm trying to adjust the front. So I'm thinking it's pulling his back.
I think there's no real evidence that that causes a problem or leads to back trouble in the future, especially if it's not on one side.
Okay.
I think if it's only been held on one shoulder, for example, then that alters, this spine. But if it is balanced and on both shoulders, then, so long as, they can carry it, it doesn't, precipitate or lead to back trouble. So on the back is okay. Carrying it on one hand, or just on one shoulder.
Like we do our backs.
Yeah, absolutely. That's the issue. So that actually alters the spine and can lead to pressure or disc bulging in the back, damage to a joint. So that's the real problem. The positioning is what's important rather than, the weights. Because if it's too heavy, they won't be able to carry it anyway.
Yes, true.
Do you know what I mean? They won't be able to carry it. But if it is suitable enough for them to carry and is balanced on the back and, being supported by both shoulders, that shouldn't, lead to issues.
Okay. I think now I'm just getting the fact that one of the most important things is for our positioning to be the natural spine and not to go out of the natural spine.
You should be aware of how your back is, yes.
Okay. You talked about practical tips. I think we did that already. But what are the biggest myths you have heard? And I like to always break myths. What are the biggest myths you've heard patients believe about not only their back pain and spinal pain, but also the whole thing about surgery? Because I feel that women, I will not lie, we're more fearful. When you say that, you're a neurosurgeon, so people come to you, and sometimes when it needs to be fixed. And I don't know if this is true, but I feel like women be more fearful. Because by the time you're talking to, you're thinking of your children and your grandchildren and all the things you need to do and how you have to reap what you've sown, and you're thinking spine. I know anytime people think spine and brain, their heart races. So, but what are the myths that you want to quench about spinal surgery or spinal care or whatever? Yes.
So, in real terms, we are more encompassing in the care. That means we start often from do nothing, advice, take things easy, go away for 6 months, go away for 1 year, just lose weight, do whatever else to avoid a surgical intervention. So we always err on the side of being conservative, that, the body can heal itself, that the patient can look after themselves. And they know where the pain is, and they often knows what they do to cause the pain.
Yes.
Do you know what I mean? So long as you can change that orientation, that listen, just look after yourself, lose weight, see how things go. It's if things don't change, then come back and we can have another discussion. So the first thing is we do nothing. If we have to operate, it means that we are forced to operate. And there are two things. We can be forced to operate if somebody has pain that is so horrible. If I have a patient who comes in, and saying that they would prefer to die rather than, cope with the pain, that level of pain is not tolerable. If I can't take it, then I look at the patient, I think, this person is also not able to take this level of pain. So what can I do to alleviate that pain? So that's the first one. In that situation, though, the patient makes the decision eventually as to whether the pain is bearable or so unbearable that they would prefer to have something done. The ones where we as surgeons will advise that the patient should undergo surgical intervention is if we can see the future. If we can see that this will not go away, that there's actually something truly wrong, or that there's damage ongoing to nerves or the spinal cord, then we would say, listen, don't joke with this. We've got to fix this. And so long as we can design an operation, that will solve this problem, then we will say, there are times when we may not be able to do anything. There are times when we truly cannot, we can only do harm. Then we'll say, listen, unfortunately, this has to be managed in whatever other way we can manage it, but it won't be an operation. But if we can operate, then we design an operation that solves the problem. When you talk about myths, people come and say that spine surgery is like 50-50.
Yes.
That it may work or it may not work. And that's not true. If any surgeon says it's 50-50, they're probably not properly trained.
This is a neurosurgeon talking.
Yeah, they're probably not well trained.
Yes.
It's either we can help
or we can't
help.
Yes, which is true.
It's either we can help or we can't help.
50-50 surgery, that means don't go.
No, that means there's no point for the surgeon, saying it's 50-50. No, we must be better than 50-50.
Yes, definitely.
So we must be able to say, okay, fine, we can deliver. Or that there may be limitations to what we can do, or that the risks are this and that. But our job is to limit that risk and try and get the outcome that you want. But 50-50, then don't have an operation. Truly. So we start by being conservative.
Yes.
But if we're going to offer an operation, then we have to be dead sure that we can deliver. If we can't deliver, then we won't be operating.
True. Now, you were saying something about sometimes when things are going bad. Now, someone could have back pain. When it comes to spine, I think and I try to put myself in the place of the patient or the person dealing with the issue. For us, the main thing is some people can even bear the pain if they know their nerves are okay, or it's not, because the worst part is anything that leads to like you can't move your legs anymore, or paralysis or anything like that. What signs should women have in mind? Or I love this episode because I think men will connect as well. What signs should we have in our minds, right? That this needs to be no more delay in terms of, yes, you said 6 weeks pain, but what signs do we have that we know this is really affecting the nerves? This is now getting beyond just I'm feeling a back pain.
That's a very good question, because when it stops being just a back pain, when anyone starts noticing numbness, that means, a part of the skin feels dead, or part of the leg or arm feels dead. That's an important sign. When you start having burning sensations, when it feels hot, like there's fire on the leg or on the hand, that's an important additional sign on top of your back trouble. If you start noticing weakness of the leg, that is important. If this foot starts going floppy, you're having to lift the leg up, to walk properly, or you feel that one leg cannot support the other properly, you're going up and down steps and it's an issue. When people go to the market, for example, and they have to stop every few minutes to relieve the back pain, they have to go looking for where to sit. That is important. So it's not just the back pain that you can't cope with. Now you can't actually even walk a short distance. Now that's important. Anytime anyone has problems with passing urine or passing stool, and things are changing with your habits in that way, it may be, a reason to get to a hospital as quickly as possible and say, what's going on? I used to have back trouble, but now there's this additional signs that I'm seeing, and I'm worried about this. Can you please check things out for me?
See, this is really important to know, because some people will not know when the red flags that they cannot.
Those are red flags.
They cannot ignore.
Those are red flags.
What would you say to the women listening? And I'm sure right now I'm getting men's attention. So what would we say to women and men listening right now who are silently struggling with back pain but afraid to seek help? Because there is fear in seeking help.
I think there's no need to be afraid. Doctors, surgeons, physiotherapists, nurses, all of us as medical practitioners, actually we want to help. We have different approaches and different things that we do. But so depending on, your access to, who you have access to, depending sometimes on budgets, may determine, who you see and where you go. But at least talk to somebody, get some information, get some advice. And yes, nowadays there's AI, there's computers, there's information on the internet, and yes, you can go online and talk to Dr. Google and get some,
Dr. ChatGPT,
and get some information and advice. But ultimately, talk to a medical practitioner or talk to a healthcare practitioner and see how they can advise. The ones I don't like are people who use native concoctions.
Or all these bone, what do you call them? Bone setters? What are they?
Bone setters or, herbal medications. I think that sometimes they delay the care. And in some situations, they may worsen, what could have been easily managed. But apart from that, I think, talking to, a healthcare practitioner may be the first step on the road to recovery.
But I think we should really dig more into these alternative ways that people deal with back pain. Sometimes a massage is good. My biggest problem I think I have is there's so many people doing things they have no business doing. They have not trained. They don't like. Even to be a massage therapist is a training, certification for a reason. Not just everybody will come and pound your back and So I feel like. Maybe you should say something about that, because anytime someone is suffering from back pain and tingling and say they went to where they do massage and the massage is very strong, enters the body very well, I'm thinking they might be resetting the bones in the back. What's your thoughts about this?
What you say is so critically important, and I say to my patients, so sometimes they ask me, should I go and see a physiotherapist? And I say, yes, go and see a physiotherapist, especially if I know that there's nothing I can do or need to do. But I say to them, and this is important, whatever the physiotherapist does must not cause pain.
Yes.
Pain equals injury. So if you go and see a traditional healer or a traditional bone setter or a traditional whatever, you go and see a masseuse or whoever it is you're seeing, and you see a physiotherapist, if what they're doing is causing pain, they are damaging something. They are making things worse. So even with physiotherapists, it must not cause pain. Whether they're doing massages, they're doing whatever exercises or programs they're putting you through, it must not cause pain. Pain means injury.
What if you already have pain? Like I know some physiotherapists try to push you.
No, but it mustn't cause pain. You can have pain naturally from whatever the problem is, but their job is to ease that pain, is to remove, not make the pain even worse. Don't worry, when you get home it will be better. No. It will definitely get worse, and it will make our lives a lot harder. There are people who have gone to see, some traditional massage people in hotel rooms, where they stand on their backs, they do, crazy things. they are doing harm. And there are times when people
I've
have
seen
come
that
out
on
of that being
social media.
paralyzed.
They're jumping,
Oh,
and I'm thinking, hey.
yeah, terrible, absolutely terrible. People have been injured by that.
Yes.
So, the advice is, but sometimes people are influenced by the financial consequences, that they can't afford going to a proper hospital or seeing a proper physiotherapist and all of that. But ultimately, they may make you so much worse that you spend a lot more money.
That's what I'm about to say.
Absolutely, so you may lose more.
Yes, you
eventually.
end up losing a lot more if you now need real spinal surgery.
Yeah, you lose a lot more.
Yeah, that's the. Now I'm gonna now talk for the Gen Zs, for the younger ones, who may think they're invincible, right? They're like, oh, I feel strong, I'm invincible. What the heck? What advice do you give them to ensure they don't grow into adults, or they're already adults? I think they're kids and they're not kids, but they grow into being like older in their 40s without back pain. What advice will you give them? Because they're not invincible.
They're not invincible. And I think more often than not, it's the way they look after themselves these days that's the issue. And the fact that technology, is there, so
And
the way
making them
people
sit down and
use their
redundant. Yeah.
phones, use computers, sit for long periods, it's those activities that they need to be aware of. I'm now seeing children, with neck pain and back pain.
Wow.
Because of the use of, mobile phones and computers, because children are now using phones for very long periods and, using computers for hours and hours on end. Now, it's not the fault of the children now, it's the parents or whoever is looking after or bringing up those children that needs to be aware that they are precipitating or, they are promoting back trouble, for these children in the future. So I think parents especially need to think about that. How long is your child using a computer for? How long are they using, mobile phone for? What's the position of their neck or their backs when they're using these devices? And just be aware of that this may lead to problems in the future.
Oh, my son will hate that I'm listening to this. But it's very important.
It is important.
Like, how long will be very long how long will be considered very long just sitting down and...
Truly, 30 minutes to an hour is long enough for any of us.
So they can get up and stretch.
Get up, stretch, go
break.
for a walk, take a break, and then come back again. So, but I said to some of my patients, don't drive to Maiduguri, because there are people who do long distance driving like that. By the time they get to their destination, they can't come out of the car.
Honestly,
because
so
the back is stiff and frozen. And some of them end up in hospital, because then they pushed out the disc or, have some significant problems. So long distance driving for us in Nigeria, because there are maybe no safe places to stop, it's an issue.
Yeah, that's a big issue.
It's a big issue. Because, if you have a...
Because in the US, when you're driving long, you can stop at all the stops, come out, stretch, then stay, go back, continue. Absolutely. But here, you might come out and that'll be you in the bush.
That's the problem we have. That's the problem we have.
Yeah, so you're just, trying to make the journey.
Absolutely, yeah.
With this good advice, honestly. So just to round up our conversation, if Nigerian women had one major change in lifestyle or healthcare assets, what difference would it make in preventing back pain and spinal problems?
I think the most important change women should consider is to keep their weight down. That is so critical, because pregnancy and childbearing, can lead to weight gain. So that's, a place where women should actually really truly think about it, and not allow this natural things happening in their lives, to then lead to problems in the future. So, with pregnancy, you're going to gain weight, but as soon as, you can, get back to exercises, get back to modifying your diet, get back to, thinking consciously about losing weight. Because if you do that, then you're preventing, problems, in the future. I think that's a critical thing that women particularly need to be aware of, that they are prone to weight gain with pregnancy and childbearing.
Yes.
But, they need to just be aware of that.
I know I said this is the last question, but something came to my mind when you said childbearing. the myth about the epidural. I don't know if it's a myth, but I know a lot of people. You see a lot of people, and I always say I'm one in a million, it's a one in a million, and they're like, "How about if I'm that?" I love Nigerians. How about if I'm that million? But you do a lot of surgeries using, I believe, spinal epidural. What is it? I mean, what do you say about that whole thought process of, oh, this could lead to paralysis. This could be the cause of chronic back pain. Because I had people say that when I did epidural for my surgery, that's when the beginning of my back pain started. So they're linking their back pain more to the epidural. I mean, what and spinal? What do you say about that?
Spinal or epidural have their own specific complications, but those complications happen, at the time of the intervention or soon after. So, spinal epidural can lead to nerve damage, but it will happen right there and then. They can lead to severe headaches. It will happen right there and then. They can lead to infection, and you will know that as soon as possible. But spinal anesthetic or epidural injections, does not precipitate or lead to this chronic back trouble. Many people think so, and they relate it to that. But that's not, in my practice, I don't see that, and I don't, we don't recognize that as being, the cause of chronic back pain or, the disc degenerating or spinal canal stenosis or anything like that. We don't think so. If it's going to happen, it happens right there and then, and you would know that this is a consequence of the epidural. So that, any issues like that happen almost immediately. You would know that this, happened after the epidural. But long-term, years later, it's not due to the epidural.
Okay. Do you have anything you want to say to us? I know I've asked lots of questions, but I don't know if there's anything that I can pull out of your mind right now to help other women out there who are, pretty much dealt with back pain, who are worried about getting back pain, or their kids, like just anything you want to say to us as a...
I think the thing is that we are all susceptible to having back trouble as a consequence of us, being upright and walking around every day, and the things we do, the kind of job we do, the things we put our body through, and like long distance driving and things like that. So everybody, there are people who think, why me? Why me? My mother or my grandmother in the village hasn't got any back trouble. No, we all have back issues, and we will all develop back issues. Question is, when do you develop it, and what are you doing that is going to lead you to having back trouble?
Yes.
All that we've been talking now really focuses on how can we prevent this? And the focus for everybody, especially everyone above the age of 30, is to start thinking, if you start having discomfort in the back, go back. What am I doing?
Yes.
That is causing this issue, and start correcting that. So long as we do that and focus on that, then, we should delay the onset of any back issues until old age. And then you can decide whether you want anything done.
I plan to be dancing and grooving till
Exactly.
I'm 90. So I can't even afford back pain. No, I am planning to keep grooving and moving and dancing.
And that's the critical thing. So we must all keep moving, keep exercising, keep our weight down, keep watching our posture, eat right. So long as we do all those things, there's something we haven't spoken about.
What?
Women over the age of 50. Especially those who are going through or, in menopause.
Menopause, yes.
They do need to worry about osteoporosis,
yes.
which is, weakness of the bones, loss of bone density. So I do give women calcium tablets, advise them to take calcium tablets, advise them to take vitamin D, advise them, to go walking, doing exercises. There must be something you're doing to reduce, bone problems. So women, in menopause or women over the age of 50 should be seriously thinking about taking calcium tablets.
One of the things I tell them, one of the things I do for those women, for women generally, is I start the whole vitamin D, calcium at 35. Funny enough.
Absolutely.
Because I always feel like you don't know when you're going to go in to menopause, but if you start the habit of doing the calcium, vitamin D, you will kind of
Absolutely.
because you can never eat enough calcium. I always say, I'm sorry, this is not the one of those I say it's going to be in food. You can never take enough calcium from food. And unfortunately, that's aging.
Yeah. True. Very true.
Part of aging. All right. I think this has been a great episode, and I know that a lot of people benefit. Thank you so much, Dr. Ogungbo. Thank you for joining us on HERcast with Dr. Chito. I hope today's conversation with Dr. Biodun Ogungbo has opened your eyes to the simple but powerful ways you can prevent back pain and protect your spinal health. Remember, your spine is your strength, and caring for it means caring for your whole self. Don't ignore the signs. Take action early and build habits that keep you strong and pain-free. So at Brain and Spine and at Arabella, we believe every woman deserves knowledge, care, and support to live fully. So share this episode with your sisters, friends, and loved ones. Let's spread the message together. You can watch full episodes on YouTube on HERcast with Dr. Chito. You can also catch us on Rapid, channel 176 Startimes, Saturday at 7 p.m. and Sunday at 2 p.m. You can follow us at HERcast Podcast and at Dr. Chito N. Until next time, stay bold, stay healthy, and keep breaking barriers. This is HERcast with Dr. Chito. Her strength, your inspiration. Be blessed.